Hi, this is Judy Salinger from Lasting Recovery, San Diego's premier outpatient alcohol and drug treatment center. And today we're talking about
Well, good morning, everybody. Thank you for coming. My name is Jeff Cox. I'm the lead counselor here at Lasting Recovery. And one of the things that we do is we have a family group so that family members can come here and be part of the client's recovery. We meet weekly, and then on the last Tuesday night of each month, we have an educational session, and the purpose is to kind of explain what is addiction. And the reason that we do that is so that we actually have a working model of what exactly it is that the clients have been going through, so that when we discuss, how to be helpful, for example, in future sessions, that everybody's kind of on the same page as far as what we're talking about. What I've found is that most people find it kind of comforting to understand addiction too, because it begins to explain some of the phenomena that they've been experiencing with their loved ones. And it also helps understand why some of the things that seem like that they should have been helpful perhaps weren't. And also why what you may be seeing in the future might not make sense to you, and maybe providing some sort of a context to help you better understand what your loved one's going to be going through as part of the recovery process. So to begin with, what I'd like to do, and what I usually like to start off with, is some definitions, so we kind of have a working model of what is addiction. And I'm going to use two, and then we'll be kind of referring back to these two different definitions throughout the talk today. The first one's going to come from an organization called the American Society of Addiction Medicine. And this is an organization of about 3,500 people, mostly medical professionals and researchers, that come together and develop a cohesive consensus on what is addiction and what are evidence-based practices in treating it. The second definition that I'm going to be giving you is one of my own, and it's more of a practical definition of addiction, and it comes not so much from a science basis, but more of a practical, experiential basis. And so we'll be working with kind of both of these concepts to help us better understand what exactly addiction is. According to, I'm going to have to read you the definition from the American Society of Addiction Medicine, and this is, by the way, this is their short definition of addiction. It starts to help us understand that this is a fairly complex disorder, and then I'll give you mine, which is going to be a little bit more brief. Addiction is a primary, and I'm going to stop right there because this word primary, when we're talking about disorders, is a word that means that it's not secondary to something else. Which is, and the reason I'm stopping and pausing on this matter is because this is something that still, even in 2014, there's a lot of confusion around in the psychology community and other communities as well. That addiction is the difference between a primary disorder and a secondary disorder is a primary disorder is its own entity, it's its own thing. You can't fix it by fixing something else. Now there may have been other things that were additive, and maybe some of the different factors that coalesce together to make addiction form in an individual, but you can't go back and fix those and expect addiction just to resolve on its own. A secondary disorder would be one that's there's symptoms of something else. You fix the primary problem, the symptoms, the secondary issue would go away. So I wanted to establish some clarity there. So addiction is a primary, chronic, ongoing disease of brain reward, motivation, memory, and related circuitry. Dysfunction in these circuits leads to the characteristic biological, psychological, social, and spiritual manifestations. This is reflected in an individual pathologically pursuing reward and/or relief by substance use and other behaviors. Addiction is characterized by the inability to consistently abstain, impairment in behavioral control, craving, diminished recognition of significant problems with one's behaviors and interpersonal relationships, and a dysfunctional emotional response. Like other chronic diseases, addiction often involves cycles of relapse and remission. Without treatment or engagement in recovery activities, addiction is progressive and can result in disability or premature death. So that's going to be, in 2014, This is going to be the definition that's basically a consensus opinion of the medical and scientific community in the United States and globally too. I mean, World Health Organization is going to have a similar statement to this. So this is a current working model of what addiction is. There's certainly other opinions. There's certainly outlier opinions, but when we look at the consensus definition of what addiction is in the scientific and medical community, this is basically the statement. And you'll notice that it's rather long and it includes a lot of different words like brain reward, motivation, memory-related circuitry. And as we go along today, we'll start getting into maybe gaining some better understanding of what they're talking about here. The second definition that we're going to be working with today is going to be my own. And it's addiction is the inability to have a casual relationship with substances. End of definition. Okay? Because that's really how it manifests. It's not an inability to have a relationship with substances. Quite to the contrary. It's just the inability to have a casual relationship. And that's what differentiates addicts from non-addicts. And it affects about 10% of the population.